Hello, I'm Emma Howard and I'm joined by Dr. Jonty Heaversedge, who's an expert on men's health problems. Hello, Jonty.
Hi, Emma.
I have a question here from a man who wants to know if there are alternatives to Viagra and can homeopathic remedies be effective, he says.
Okay, I'm not an expert on homeopathy, and I have to say I've not seen any research suggesting that remedies are effective. There are a lot of herbal remedies on the market. A lot of them have come from India and from the Far East, which I guess it may be worth trying. Again, I've seen no good research to back them up as an alternative to Viagra if you have erectile dysfunction. But the power of suggestion, particularly when it comes to issues around erections and potency, I think is quite significant. So if it helps, then it may be worth trying them.
Would you be interested at all in this person's age? I mean, is that relevant when they want to know if Viagra would help their condition, do you think?
Well, I think absolutely. I think what's most relevant is actually what's underlying the problem, because erectile dysfunction always has a psychological element, but sometimes it has a significant physical element as well. So it's important that he's been checked out to make sure he's not diabetic, he doesn't have high blood pressure. These are conditions that can contribute to erectile dysfunction.
Which would probably need a discussion with a doctor. It's almost sounding like this is somebody who doesn't want to go and talk about this.
Absolutely, and is hoping that actually there'll be an answer that doesn't involve a discussion with a doctor. But anyone with erectile dysfunction needs to talk to the doctor, because there are physical conditions that can cause it that need to be identified. And actually also there are psychological conditions that predispose to it. So a lot of men may be suffering with depression, which is something they struggle to own up about. And that definitely will also affect erectile
And just
function.
talking about that just to one person could make a big difference, couldn't it?
It could make a huge difference, because it might be that if you can treat those problems actually and maximise your treatment of diabetes, of high blood pressure or of depression, that actually it's then possible to get normal erections again without specific treatments such as Viagra.
Great, good advice, Jonty. Thank you very much. Well, if you have a similar problem, we hope we might have given you some help. But remember, it's always best to go and see your own doctor for medical advice. Thanks for watching. We'll be back with more health questions and answers.